For more, let's bring in our panel tonight. Todd Webster, Democratic strategist. Sam Stein, political reporter for the Huffington Post, is with us. And Ron Christie, Republican strategist. Todd Webster, let's talk about the House vote. Where's the victory here? 6 million people in the public option, a mandate to give money to the private insurance industry. Where's the victory here?
Well, you have to start somewhere, Ed. It's not the plan that I would have chosen. I think that we ought to expand Medicare. I think that's the perfect model for dealing with health care. There's not a senior in this country who does not love Medicare and wouldn't love to see that expanded. If you don't like Medicare, you can opt out and go pay Cigna or Humana, $1,400 a month and do the private plan.
But this is the government writing a check to subsidize to patients, and patients are going to be forced to go buy insurance. Where's the victory here for the liberals?
It is an important first step, Ed. I think these things don't happen overnight. That's the reality. I do think you need to give Nancy Pelosi, Speaker Pelosi, a lot of credit for getting this bill through. It's the first time in more than 40 years since Medicare was passed in 1965 that you see a real health care reform on this scale passed. And let's not forget that. That's a huge
I tell you, I got a lot of friends in the House. I got a lot of friends on the Hill. But this is a time where politicians start breaking their arm, patting themselves on the back. I'm telling you, the progressives in this country think that this House bill falls short. Ron Christie, is this a victory of sorts for the conservatives?
Oh, I don't think of this in terms of a victory for the conservatives. The question is this a victory for the American people for trying to advance meaningful health reform? And I think the answer to that is no. Given what President Obama has said, he said that he would veto a bill that reached his desk if it increased taxes by 1 dime. Well, we should stop this debate, Ed, because we've seen that the House bill will increase taxes by billions of dollars. The Democrats have been very disingenuous with the American people. They said that they were going to reduce costs, that they said that they were going to cover more people, and they were going to do this in a fair way. More taxes, not a universal coverage.
Well, tax in the top 2%. You're right. They are going to. But we've said that all along.
No, but Obama said. Remember, President Obama said if there was a tax increase by 1 dime, he was going to veto it. So, given by the president's own logic, Ed, he should veto this bill. And we should start over.
What about all that, Sam? What do you think?
I think Ron's very adept at reading talking points. There's a lot to be there's a lot to be proud of the plan for Democrats. I think expansion of coverage being the first and foremost. There's going to be 36 million people who will have insurance who previously did not, and I think that's a noble achievement. And certainly there's a lot to be disappointed with. I mean, just look at the public option, which was incredibly watered down from its conception. At the end of the day, it's a dirty and disgusting process.
All right, gentlemen, we got to talk about a very controversial provision in all of this. The pro-choice caucus has sent a letter to Nancy Pelosi. The Stupak-Pitts amendment represents an unprecedented and unacceptable restriction on women's ability to access the full range of reproductive health services to which they are lawfully entitled. We will not vote for a conference report that contains language that restricts women's rights to choose any further than current law. Todd Webster, these are fighting words. This tells me that if this comes back, and if they deny funding for abortions in this health care bill, the House isn't going to vote for it. They won't have the votes.
Good for them. The amendment that passed will impact overwhelmingly poor, younger women. The people who passed that bill overwhelmingly are older white men. It's patently unfair, and this is a step that they need to take to try to fix it.
Is this the issue that's going to stop health care reform in its tracks and slow the Obama agenda? What do you think?
I think it could, Ed. I think that there are enough progressives who are very upset with the Stupak provision being in there. And there are a lot of conservative and centrist Democrats that if the provision wasn't in there, wouldn't vote for it. So I think this could derail health care for the Democrats.
What's the president's play on this, Sam?
Well, I think the president, who has been totally hands-off, continues to be totally hands-off on this specifically, declined to address 5 questions about this. I have to disagree with my colleagues. If anything, through this debate, the Progressive Caucus, as much as they should be applauded for their goals, have been proven that they're easily pushed over. They were opposed to the Stupak Amendment in the first go-around. They're opposed to negotiated rates for the public option in the first go-around. Each time they caved in the end. I think, unfortunately, what you see is they'll do it again.
Well,
there's no other way to interpret it.
You've got a subsidy that's going to be going to women. Then they're going to be forced to buy from the private market.
And a supplemental plan.
I don't know how you can get around it. It's going to be interesting, fellas. Thanks a lot.